I want to talk about bupropion. Bupropion. Are you familiar with that? Well, the trade name could be Wellbutrin or ZYBAN. Let's go. Bupropion, that is Wellbutrin or ZYBAN, is a non-epinephrine dopamine reuptake inhibitor, i.e. NDRI. It is similar to phenethylamines and is also known as nicotine receptor antagonist. No wonder it's used in smoking cessation program. Uses is used as atypical antidepressant for the treatment of major depressive disorder, but you can now use the ban here, okay, for attention deficit and hyperactive disorders in children or adolescents. You can use any of the brand names, either generic, Wellbutrin, or ZYBAN. But for major depressive disorder, no ZYBAN. For smoking cessation, you use only ZYBAN slow releasing. For weight reduction, particularly in people with high body mass index, you can use any of the brands. It's also useful in inflammatory bowel disease, neuropathic pain, sexual dysfunction secondary to other antidepressants like selective serotonin reuptake inhibitors, and used in bipolar as mood stabilizer adjunct. Also useful in seasonal affective disorder, where you use only apezine and Wellbutrin. So you don't use ZYBAN and the rest for seasonal affective disorder. You can use ZYBAN or Wellbutrin or apezine or other brands for any of the above situations as I have indicated. For example, if you are targeting smoking, then you use only ZYBAN. But if you are targeting depression, you don't use ZYBAN, just as I've said earlier. So if anybody is presenting for treatment and is having problem with smoking, depression, neuropathic pain, or is on antidepressant and now having sexual dysfunction, you can go for any of the applicable bupropion based on the brand names. Just go over my last page of this presentation, then you'll be able to make the appropriate selection. Availability. Bupropion, depending on the brand, could be available in tablet forms and dosages of 75 mg up to 200 mg, and sometimes if it's generic form up to 450 mg, for Vivo up to 450 mg, and apezine from 174 mg to 522 mg. ZYBAN is available in 150 mg. Wellbutrin is up to 300 mg extended release, and also Wellbutrin slow release. It's also available as 24-hour coverage if it is extended release. In other words, if you use Wellbutrin extended release, the duration of action will last for 24 hours. But if you use sustained release, like ZYBAN sustained release, then you're going to have 12 hours duration of action. And immediate release will last 6 hours. What are the possible contraindications? Eating disorders. You are going to pick that from the history, seizures disorders, psychosis, or hypersensitivity to bupropion. You will not use any of the brand. Contraindications will still continue, and It's good to know that you cannot suddenly stop ethanol or any sedatives and just pick bupropion. No. So, abrupt or sudden stoppage of ethanol or sedatives is not welcome, and then start bupropion. Monoamine oxidase inhibitors use within 2 weeks prior to or after bupropion is contraindicated, meaning you cannot suddenly stop bupropion and then start monoamine oxidase inhibitor or vice versa. So, if you are on monoamine oxidase inhibitors and you would like to take bupropion, your doctor will guide you that it will take some time before you can start bupropion. The same is applicable when it comes to linezolid, 2 weeks gap. As a matter of fact, I would prefer a month between this type of medications, that is between linezolid and monoamine oxidase inhibitors before the onset of bupropion or vice versa, which means if bupropion has just been stopped, then I can only start linezolid or monoamine oxidase inhibitors a month after them. What about possible increased intracranial pressure? By what? By central nervous system tumor, brain abscess, meningitis, encephalitis, head injury, intravenous malformation. If that is the situation, then no bupropion, please. How about tauridazine in the last 2 weeks? No bupropion if tauridazine has been used in the last 2 weeks. How about other forms of bupropion? If the patient is on other forms of bupropion, there's no need to double dose. I'm not going to give anyone right now. How about concomitant use of bupropion with ECT? How do I mean by ECT? Electroconvulsive therapy. The side effects of electroconvulsive therapy will be worsened if used concomitantly with bupropion. So keep bupropion away for a while before ECT, or you have your ECT done for some time, then you start your bupropion, not concomitantly used. Note, increased risk of suicide is very common among younger age group that are using bupropion. So we have to keep an eye on younger age group people that are taking bupropion, including adults that are taking bupropion for the purpose of depression, because they can have energy and they have energy while still having their suicidal ideation, then they may have opportunity to commit frank suicide. So an eye should be kept on anyone taking bupropion, particularly younger age group, and older age groups that are using it for depression. What are other side effects? CNS stimulation, cognitive impairment, hypersensitivity, increased blood pressure, can also precipitate mania, particularly while treating depression. There is possibility of changes in mood if used for smoking cessation, that is the ban, particularly when faced with nicotine withdrawal, or sometimes those that sneak to still smoke. The meaning of this is you have placed your patient on Zyban for smoking cessation. You are likely going to find changes in mood, okay, if you are now facing the withdrawal effect of nicotine. That's one. Or the patient is actually going behind to smoke. So you watch out for changes in mood while on Zyban for smoking cessation. Other side effects will include narrow angle glaucoma, seizure will increase, possibility of psychosis getting worse, there's possibility of weight loss, and the reason why some use it to control their body mass index. Cardiac arrest is very possible in kids that are on bupropion for attention deficit and hyperactive disorder. Therefore, thorough cardiovascular examination is necessary prior to initiation of the therapy. You have to decrease the dose of bupropion in hepatic dysfunction because of the need for metabolism, or the same reason for renal dysfunction, and in elderly people because there is organ degeneration, pan-organ degeneration in elderly. Low dose alternatives in breastfeeding mothers because preferably you don't want to even use it in breastfeeding mothers, but please, no matter who is taking this medication, particularly for depression, watch out for signs of suicide. And there are a lot of drug-drug interaction. It's better you confer with a pharmacist or you go through the manufacturer instruction as far as drug-drug interaction is concerned, because there are lots of other medications are interacting with bupropion. And with that, I come to the end of this short presentation on bupropion. I hope it's of benefit to anyone who is listening. Thanks so much. Kindly subscribe to my channel and you'll be able to get these presentations immediately they're published. Thanks.